Scared and exposed as the deadly new coronavirus claims over 2,233 lives, China is grappling to contain the outbreak, but data mistrust is increasing. Beijing has yet again changed the coronavirus counting method. The number of COVID-19 cases in the central Hubei province, which is the epicenter of the outbreak, dropped sharply after China yet again changed the way it officially reported the number of infections. Today, Hubei, in its daily tally, confirmed 115 new virus deaths. There are more than 75,000 confirmed cases around the world now. It's the second revision in a month. The changes are feeding growing suspicion over official data from China. No official explanation has been given for the sudden decline in the figures. However, the sharp drop in numbers comes a day after new national guidelines advised the central Hubei province to only report two numbers in its overall count, which is confirmed and suspected cases. So what's going on with China's coronavirus case and the death numbers being reported? It's not the first time that China has changed its counting methodology. Prior to this, on the 13th of February, China reported a drop in the number of new cases that have been confirmed. Hopes were raised that the outbreak might be slowing down. But a day later, Hubei abruptly announced that there had been nearly 15,000 new cases overnight. The government then pointed out that the outbreak didn't suddenly get worse. The authorities simply changed the way they reported cases in order to allow more people to access treatment faster. Questions are compounding on China's counting method in the meanwhile. The shifting classification guidelines, the lack of clarity, and yet another recalculation of the contours of the crisis. So can the world rely on the numbers coming out of China? Now, WION is at the top of each and every development of the deadly coronavirus pandemic since day one. And to get the sense of ground zero, we have partnered with Chinese media network CGTN. And now we'll be joined by CGTN correspondent Jiaxin Zhou, live from Wuhan city. Thank you so much for being with us here on the broadcast on WION World is One. I want to begin by asking, now, Wuhan is the epicenter of the deadly coronavirus outbreak. The number of infections reported per day has gone down drastically, but the death rate remains high. What exactly is the reason for that?
Thanks for having me. Thanks to the effective containment measures, I have to say, in the epicenter of the outbreak, the infections have been considerably curbed with stricter restrictions. As you said, regarding the death in hospitals, I believe medical workers are racing against time to save lives. I'd like to cite a WHO report saying that most COVID-19 deaths appear to be from multi-organ failures. And current estimates put the virus fatality rate around 2.5%. That's much lower than SARS, which had a global fatality rate of around 10%. Having said that, WHO notes about 82% of patients are mild, meaning these kinds of illnesses requires little or no treatment in hospital. And statistically, cumulative numbers of confirmed cases in China now surpassed 75,000, and over 2,000 of them died and 18,000 recovered. Among the deaths, I mentioned earlier in your program that we learned many elderly had other complications.
Right. Jiaxin, for the second time, China has changed the method of counting patients infected with the new coronavirus. Can you explain to us the new methodology and, more importantly, the reason why it has been changed again?
On February 12th, as I mentioned, procedures for diagnosing COVID-19 was changed from solely uric acid test to clinical diagnosis, which also involves a CT image showing a potential viral pneumonia. On Wednesday this week, the category of clinically diagnosed cases from CT scanning has been removed from confirmed cases. At a Thursday press conference, an infectious disease expert explained that the original category was created to offer patients waiting for the new nucleic acid test timely treatment to reduce the fatality rate. So the situation for the capacity of testing kits now has been greatly improved, and patients can be quickly and accurately screened out. And the latest diagnosis standard is now the same nationwide, including the suspected cases and confirmed cases, and enough beds are also provided for both.
Right. If I can ask you at this stage, any update on when the disease is expected to peak?
I think everybody is concerned about turning point of the epidemic. And I guess Chinese authorities, even those infectious disease specialists, are very cautious about talking this. But given the drastic decrease in the newly confirmed cases, as you mentioned, and rapid increase of discharged surpassing the confirmed, some argue that if these key indicators are forming a positive trend with no signs of rebound, the real peak would not be far away from us. Worth mentioning, outside Hubei province, the daily confirmed cases have dropped 2/3 from 2 weeks ago, and that number in Wuhan city alone was a drop of 90% from a week ago.
Jiaxin, before we let you go, how are the people in China, especially in Wuhan, coping with this adversity at this moment, and what's the latest on the vaccine?
Yes, actually, it is hard to tell everyone, but on Chinese version of TikTok, a popular video social media, I've seen two major moves. They're through high-rate clinics. One is about action. Those who refuse to wear masks in public places would be despised and persuaded to do so. It's like a national campaign now in which almost everyone in a preparation for the epidemic prevention, such as stay at home, protection when outside, coping with community workers for daily deliveries of food and other necessities despite lockdowns. Another about emotion, which actually has been widely shared among us. We admire dedicated medical workers and volunteers from all walks of life in this adversity. And they're also inspiring everyone to pull through. But some articles from Western media appeared offensive on the pretext of freedom of speech. And I hope that their journalists would also show us a bigger picture, and that's why CGTN wants to let our international audience to see difference, not a narrow one. And you were talking about the vaccine, because this is also a question that many raised at the moment. During the press conference, actually, this afternoon, Chinese authorities say the coronavirus vaccine is expected to be submitted for clinical trials as early as April, adding that the vaccine is a time-consuming process, given that COVID-19 is the new type of virus and uncertain factors still remain. Some of the vaccine projects have already entered the animal experiment stage. Besides, 3 drugs have been enlisted in the latest diagnosis and treatment plan, which also includes the traditional Chinese medicine, convalescent plasma therapy. On Thursday, WHO also announced that preliminary results from clinical trials of therapeutics against COVID-19 are expected in 3 weeks. So no magic dose yet, but hope is there with some common challenges for all of us. Back to India.
Jiaxin, Zhou joining us with that live update from the epicenter of the coronavirus outbreak, Wuhan city in China. Thank you for being with us here on this live broadcast.
Thank you.